In this video, we will discuss about spinal cord anatomy and organization. We will go through a cross-section of spinal cord. Here is a diagrammatic representation of spinal cord. There are two distinct parts present in it. The one on the outer area is known as white matter and it consists of axons. The centrally placed grey area is called grey matter and it consists of neural cell bodies. The large groove present in front of the spinal cord is called ventral median fissure. The smaller groove present at the back of the spinal cord is called dorsal median groove. These features help us to orientate spinal cord. The central canal runs through the center of the spinal cord. The cerebrospinal fluid travels in it. Let's look at some less obvious features of the spinal cord. The axons run up and down the spinal cord in bundles known as fasciculus. The first two fasciculus originate from the back of the spinal cord. These are known as gracile and cuneate fasciculi. Collectively, they are called the dorsal column. The primary function of dorsal column is to convey senses of fine touch and proprioception or joint position to the brain. Off to the side here we have the lateral corticospinal tract, which carries limb motor or limb movement information to the brain. Alongside the ventral median fissure, we have the ventral corticospinal tract that conveys messages for axial motor. Axial motor contains the muscles, excluding that of limbs. Back at the side, we have lateral spinothalamic tract that conveys impulses for pain and temperature. And at the front, we have anterior spinothalamic tract that conveys impulses of crude touch from the body to the brain. Up here we have the lessors fasciculus or posterolateral tract that conveys impulses of pain, temperature and light touch. Towards the anterior end we have a decussation of tracts known as anterior white commissure. A decussation is when the axons travel from the left side of the body to the right or vice versa. Here is the summary of spinal cord anatomy and organization.